Well, good afternoon, everybody. Appreciate you taking some time out of your day here to join us. My name is Matt Fleming, certified financial planner here with Thimble Island Private Wealth. And this is our second installment of Financial Fridays. So we're thankful to have Tom Tropiano joining us today, doing a little bit of understanding Medicare. So Tom's a Medicare advisor, independent insurance broker in the local area here in North Branford, Connecticut. And we thought at this time of the year, again, often a lot of questions that we come across in meeting with folks thinking about planning for retirement. Often the questions turn to medical expenses and Medicare. So we thought it'd be a great opportunity to have an expert like Tom sort of join us, give us a little bit of an overview on Medicare. What is it? Help us understand it a little bit in some ways. We'll tie in at the end some ways that we might be able to potentially help you as you plan for that through retirement there. So without any further ado, I'm going to turn it over to Tom here. And again, Tom, we really appreciate you taking the time here and joining us today.
Thank you, Matt. Thank you for the introduction. Good morning, everyone. The presentation today is going to be an educational presentation on understanding Medicare. Again, like Matt said, there's a lot going on in Medicare, a lot of changes going on. We're in the annual enrollment period right now for 2025, going into 2026. So if you have any questions, write them down, and at the end, I'll be happy to answer them. So if you want to click on that, Matt, please. Okay. Again, I'm local, licensed, certified, independent insurance agent residing in North Branford, Connecticut. My desire is always to be an advocate for my clients, my alliances to my clients. I get compensated by the insurance companies. I'm licensed and appointed with all the major insurance companies. But again, my alliances to my clients, especially this time of year, I review all their medications and all their doctors to make sure that the plan they're in is still the most effective plan for them. Okay, today we're going to cover what is Medicare, who's eligible, understanding parts A, B, C, and D, what's covered, what's not covered, and what to consider in choosing plans. Okay, again, this is just an overview of what I do. Again, my services are complimentary. I review my clients' plans every year. So if you're a client of mine, you would get a phone call from me at least annually or sometimes during the year. I have clients that call me up, ask me questions, especially when their health changes a little bit too. So we're constantly in conversation during the year. Also, again, I enjoy immensely helping seniors with their healthcare plans. Okay. What is Medicare? It's a federal program to provide health insurance at an affordable cost to anyone who's age 65 and over, people under 65 on Social Security disability, people with end-stage renal disease. You must be fully insured. That means you had to work 10 years in a Medicare-covered employment, yourself or your spouse, citizen and permanent resident of the U.S. in order to qualify for Medicare. This is Part A and Part B. It's called Original Medicare. It's what we get from the federal government. They provide this for us. Part A, and we'll cover this in more detail, is hospitalization, inpatient care. B is everything else, doctor visits, MRIs, surgeries, and so forth. When you apply for Medicare Part A and B, and we'll go into that later on, you're going to get a card. It's going to be a red, white, and blue card. It's going to have your name on it. It's going to have a combination of 11 numbers and digits, or letters and digits on there. They used to have Social Security numbers on there. They did away with that because of the identity theft. And they'll have Part A effective date and Part B effective date, but that's what your card will look like. Go ahead, Matt. Okay. Medicare doesn't cover 100% of your health insurance. Okay. So what we have to do, we have to pick up a secondary Medicare plan or option. Okay. So there's two options available. When you pick up Medicare Part A and Part B, option one is to go into what they call a Medicare supplement or Medigap. You pay a premium for that. It's very comprehensive. And then you also have to pick up a prescription drug plan, okay, with a premium also. Option two is you see a lot of local commercials all the time for what they call Medicare Advantage plan or Part C. That includes your prescriptions, and it includes some other benefits like dental, vision, and hearing. These are both options that are provided by private insurance companies, not by the federal government. Federal government only provides Part A and Part B. Again, A and B doesn't cover 100% of your health insurance, so it's important to pick up a secondary option. Okay, Medicare Part A, hospital cost, right? We talked about if you paid into Medicare for 10 years, your premium is zero for Part A. You don't have to pay. If you didn't pay in 10 years into Medicare, there could be a cost for Part A up to $515. Probably 99% of the people that I've come across all paid into Medicare, so they don't have a premium for Part A. But if you don't pick up a secondary option and you wind up in a hospital, you're going to pay $16.76 for your deductible for 60 days, and then you're going to pay a per day cost each day after that. Again, there's no max out-of-pocket limit protection, so it's really critical to pick up a secondary option. Go ahead, Matt. Part B has a premium attached to it, okay? And we'll discuss how that's calculated. There is an annual deductible this year of $257. Next year it's going up to $283. There's a 20% co-insurance cost. Again, it doesn't cover, only covers 80%, doesn't cover 100%. So there's no max out-of-pocket protection again. So it's critical to pick up that secondary option. I can't emphasize that enough. So I said that the premium is $185. That's the base premium. It's based on your income. So the next chart is going to go over income charts and incomes and how much you would pay if you retired and picked up Medicare today. Okay, this is your Medicare looks at your adjusted gross income 2 years back. So in 26, they're going to be looking at 24s. They actually look at your tax return, your adjusted gross income. And right now, it's 185 is the base, right? So if you file as an individual and you make 106,000 or less, you're going to pay 185. If you file jointly and you make 212,000 or less, you'll pay 185. Everybody pays a Part B premium. Now, let's say as you go up, let's say you and your wife make $250,000. You're going to pay an increase because there's a Part B premium increase and a Part D increase. You would be paying $272.70 each. Okay. As you move up the ladder a little bit and you make more money and you're still working and they go back every 2 years, you could be paying more money, $400, $500, $600. Now, that being said, when someone wants to go on Medicare A and B, they're typically leaving their workforce a lot of times. So what happens? They're retiring, so their income goes down. But Medicare looks back 2 years and they'll say, okay, you're going to pay this higher amount. There's a form that you can fill out, and it's I have it here. It's called Medicare Income Related Monthly Adjustment Life-Changing Event Form. If you complete that form and say, hey, in 2026, I retired, here's my income, my projected income is going to be a lot lower. You bring that to Social Security. 99% of the time, they lower your premium for Part B. So I always recommend anyone who's retiring and has a higher income when they were working to fill out the form and bring it to Social Security so we can pay that lower amount. So there are options to get that amount, that Part B premium down. So again, I encourage that if anyone needs that form, I'd be happy to email it to them also. All right, Matt. Okay, when to enroll in Parts A and B. My wife, she retired, picked up Social Security when she was 63. So when she was turning 65, she didn't have to do anything. Automatically, she was enrolled in Part A and B. They would send her, Social Security sent her the card, and she had it. She didn't have to apply for it. And that's who we get A and B from. We get it from Social Security. That's who we apply in order to get our Medicare A and B. Now, lots of people who are turning 65 and they know they want to go on to Medicare, they have a 7-month window, 3 months before the month they turn 65, the month they turn 65, and 3 months after they turn 65 is a 7-month window. They could apply for Medicare Part A and Part B. The easiest way to do it is go to ssa.gov. It's a Social Security website. If you're comfortable on the computer, it's really easy. You just apply for Medicare A and B. You could also call Social Security. If you do call them, they're going to say, okay, hey, in January 15th at 3 o'clock in the afternoon, I'm going to call you back and we'll do the enrollment. They give you a date and time in order to do it. But again, the computer is the easiest way. I encourage people, if they know they want to, as they're turning 65, they want to go on Medicare. I encourage them to do it early, 3 months at least, or sometimes, 2 months prior. But sometimes Social Security takes a while to get that in their system. So again, I encourage individuals to do it early on. Now, the last one happens a lot. I'm 65 years old and I'm still working, or my spouse is still working. I'm still receiving employer medical benefits. It's called credible insurance, and I don't want to retire yet. So I can't pick up just Part A if I wanted to, which has no premium, and I could put B on a hold and do nothing right now and wait till I retire. Now, that being said, if I'm contributing to an HSA, I should do nothing because you can get penalized if you're contributing to HSA and you pick up Part A. So at that point, do nothing. Don't pick up A or B. Just continue to make sure you have credible insurance at work. And then when you're ready to retire, within 8 months of leaving employment,
Oh, well, we might have, Tom might have froze here. Apologies. Let's see if he's,
again, I'd be happy to email those forms to you. Again, it's critical that you have credible insurance, because if you don't, there's a penalty for picking up Part B late, and it's a monthly penalty for the rest of your life. So it's really critical that we do that on time. Next, please. Go ahead, Matt. It's frozen.
oh, we should be good there.
Okay. Can you hit the next one, or it's not? It's frozen. It looks like it's not going.
Are you seeing the penalties on the screen?
Yeah, I'm not seeing. I'm just seeing when to enroll.
Okay. Yeah, you might be frozen there. Hold on one second.
Right? It's important to make sure those forms are filled out by your employer. There's a 10% for each full 12-month period that you could have had Part B and didn't sign up for it. I had one individual at one of my seminars who missed it by like 7 years. And she thought she had credible insurance, but she retired from work. She was just paying for health insurance. And I'm like, that's not credible insurance. So by the time she applied for Part B, the penalty was so big. I said, just cancel Part B and just continue to pay for your insurance. It's not worth it at this point. It's really critical to pick it up when you're eligible. And there's a time period. So I had someone else recently who lost their Part B because they didn't pay it. And now they have to pick it up in January, February, or March of 2026 in order to get it. They're going to have a year's worth of penalties. So again, I just encourage everyone to make sure you pick up Part B when you're eligible.
Apologies again for the
next page. Is it good? Yeah, it's kind of like,
yeah, it's your internet's been going out in and out a little bit, Tom.
Oh, okay.
So I don't know. It might be frozen there. So are you on the? You should be seeing the Medigap supplement page now.
Yeah, I'm not seeing it, but I'll work off of mine.
Sure.
Okay, so let's talk about Medigap supplement. That was the first option we talked about. It covers out-of-pocket costs, co-pays, co-insurance, deductibles. They're sold by private insurance companies. The nice thing about Medigap or supplement, you can see any Medicare provider anywhere in the U.S. There's no network, so it's really, really nice in order to, especially people that go to Florida or South Carolina, they want to go there for 4 or 5 months during the year. They can have providers down there also. There's no network. People love that about the supplement. Must have Medicare Part A and Part B. Part D is sold separate, and you cannot have a Medicare Advantage plan and a Part D. They don't go together, or you can't have a Medicare Advantage plan and a supplement. So you can have the Advantage plan, or you can have a supplement with a D connected to it. Okay. Next one, please. If it doesn't go, I'll just, okay, perfect. Okay, it's working now. Okay, what are the options with Medicare supplements? So the Medicare supplements start with Plan A, they go to all the way to Plan N. Typically, as if you're 65 now, they're limited to G and N. They're federally regulated coverage. So if I have a G plan with one company or a G plan with another, they're identical coverage. Same thing with the N plan. The only difference between carriers is price, the premium, and value-added discounts or services like dental and vision discounts. But the plan coverage is identical. Typically, people go with the premium. Sometimes if there's a lower premium, they'll pick up the plan with the lower premium. Next, please. Okay. Again, this is just showing it's a lot on this screen is showing plans A, B, D, G, K, L, M, N. Again, we're limited to only 2 plans left right now. They're the N and the G plan. If someone is disabled under 65, there's an A and the B available to them. But typically 65 and older, we're a G and N right now, unless you turned 65 before 1/1 of 2020. But typically, if you're younger, you're going to be limited to those 2 plans. Next one, please, Matt. Okay, so the F plan again was available up until 1/1/2020, and the F plan is very comprehensive. 100% coverage in hospital. There's no copay after you meet your annual deductible, which is on G and N. The F didn't have a deductible; it was already included in the premium. You go get an MRI, CAT scan, it's full coverage. People loved it. No network, very comprehensive. It has a premium attached to it. G is very common today. It's 100% coverage again. If you go see a provider, it covers 100% of the costs, especially someone has like a knee surgery and they want to do a lot of physical therapy. Every time they go, it's covered 100%. Very comprehensive plan. The N plan is identical to G. The only difference is when you see a provider, you pay $20. If you go to the emergency room, you pay $50. In the G, you pay nothing, but the premium is less on the N. And lots of times with people who might only see 1 or 2 providers a year, they'll typically pick up the N plan. Now, what's become really popular is the high deductible plan G. So how that works is someone has the advantage of using a supplement, no network, seeing any doctor, any hospital in the country, very low cost premium, but they have a high deductible. What that means is that they pay their every time they go see a provider, they pay the full price or 20% of what the cost is until they hit $28.70 in medical bills, and then after that, the plan picks up 100%. So I have healthy individuals who say, you know what, I hardly see doctors. I hardly even use my health plan. This would be perfect for me. So a lot of people go into the plan, high deductible plan G, just because it works for them. Again, I'll talk about health issues later on with supplements too, because a lot of times someone who might have health issues move into someone, I have clients who have cancer and they have chemo. They're on a supplement, pays 100% of the chemo for them. I have some individuals who might have $300,000 worth of medical bills and just pay their premium. It's covered 100%. So people love supplement for a lot of reasons. So they're really good plans. Go ahead, Matt. Okay. What Medicare doesn't cover? It doesn't cover custodial or personal long-term care. It covers skilled nursing. So if someone had a knee surgery or God forbid someone had a stroke and they wind up in a nursing home and they see improvement every day, skilled nursing is going to cover it up to 100 days. When they stop seeing improvement, days 20, 22, 25 and on, it turns to long-term care. And that's when you pay full price for your services in that facility. So again, custodial and personal long-term care is not covered under Medicare. Concierge medicine has gotten really big around here now. That's where doctors now have left Yale hospitals or Yale network, and Hartford Healthcare Network, and they went on their own. They said, okay, if you give me $5,000, I'm your doctor. Here's my cell phone. Call me 24/7. And a lot of doctors, primary care physicians, are moving in that direction now. So concierge medicine has gotten really big around here now too. So Medicare doesn't cover concierge. Service from providers who opt out of Medicare. So I was telling you that as long as Medicare covers it, supplement will cover it, right? But there are doctors, occasionally you'll see a maybe 85-year-old primary care physician who doesn't take Medicare. 99.9% of everyone in the country accepts Medicare. But again, you got to make sure your provider accepts it. Cosmetic surgery, massage therapy is not covered by Medicare. And the plans cover out of the country, out of the US. So the supplements, the advantage plans have coverage, but Medicare itself doesn't cover out of the country. Vision for just routine eye exams are not covered, but if you have glaucoma or cataracts, that's covered. And dental and hearing are not covered by Medicare or the supplements. Go ahead, Matt. Okay, so we talked about what the supplement covers. Now we have to pick up a prescription drug plan, which is called Part D, right? So we pick up a prescription drug plan, which lowers our prescription drug costs. It's managed by private insurance companies. You must live in the plan service area. So Connecticut, for example, you can have one plan. If you move down south, you have to get into a different plan. Costs vary from preferred pharmacy to standard pharmacies. And I always tell my clients who the preferred pharmacies are. And most of the time, most of the Advantage plans include the prescription drug plan in their plan. And if you don't purchase Part D when eligible, you also pay a monthly fee for the rest of your life. Now, I have clients who have no prescriptions, and they're like, okay, why do I have to pick up a prescription drug plan? I'm like, the plans are really inexpensive to pick up, but say someday that you need a very expensive prescription, God forbid you got cancer and you need a oral chemo treatment, and some of these treatments and pills are $10,000, $12,000, $15,000. I have clients who have catastrophic prescriptions. So it's important to make sure we get a plan early on. And then if we don't need it, great. Our health is awesome. But later on, when we have the plan, if we need it, it's there and available for us. Go ahead, Matt. Okay. The drug plans are all categorized. The drugs are categorized in tiers. Tier 1, 2, 3, 4, and 5. Tier 1 is preferred generic. Tier 2 is generic. 3 is brand name. 4 and 5 are specialty drugs. Obviously, the preferred generic are the least expensive. So if you have tier 1 and 2, lots of times you might not have any copays when you pick up your prescriptions. All these plans do have a deductible, but they typically only apply to tiers 3, 4, and 5. So if you have tier 1 and 2, you're not paying a deductible. But if you have a 3, 4, and 5, you will pay a deductible. The key is to look at your prescriptions every single year, because the formularies change every year. You want to make sure that your prescriptions are covered in the formulary. If not, you're paying full price for that prescription. So it's really critical to review your prescriptions every single year. Go ahead, Matt. Okay, so the Inflation Reduction Act, and I think it was 2022 or 23 when they signed it into law, it did away with there used to be called a donut hole where people would pay a lot of money for the prescriptions. They eliminated that this year, 2025. Now the max out of pocket anyone's going to pay for prescriptions is $2,000. Okay, not including the premium, just the copays, be $2,000 out of pocket. And they also introduced what they call a smoothing process, where you can actually call the insurance carrier up and say, listen, because I have $2,000 worth of prescription costs, can you bill me equal payments for 12 months? And the insurance companies will do that for you. You'll get a bill, you'll pay it, and when you go to the pharmacy, you pay nothing. You just pick up your prescription. So it allows people to spread out the cost of their prescriptions over 12 months. So that's available. That's new for 2025. Go ahead, Matt. Okay. Prescription drug benefits. So all prescription drug plans have a monthly premium and have an annual deductible. This says $590, and next year it's $615, typically applying to tiers 3, 4, and 5. Prescription drug benefits work off a calendar year, so January 1st to December 31st, then they reset themselves again. Plans, we talked about the formulary, they all use a formulary to list their drugs. Most plans place drugs into tiers or levels. And prior authorization, some drugs require your provider to contact the drug plan before you can fill certain prescriptions. Quantity limits, you see those a lot with pain medication. And step therapy requires you to try one or more similar lower cost drugs before the plan will cover the prescribed drugs. Lots of times people ask for exceptions, and lots of times they get those exceptions too, but the provider will have to call the drug company up in order to get that. Go ahead, Matt. Okay, just to recap again, we'll go back one, please. Okay, again, no donut hole. We said $2,000 this year. Next year is $2,100 max out of pocket. So it's changing in the next 3 weeks, okay, because we're already almost into January. So again, it's going to be $2,100 max out of pocket for prescriptions in 2026. Go ahead, Matt. Okay. We talked about supplement, picking up a separate prescription drug plan. That's option one. Option two is to pick up what they call a Medicare Advantage plan, or Part C. Those are HMOs. Those are health maintenance organizations. Those have a small network of doctors. You got to make sure that you stay in network. If you leave the network, you're going to pay full price. PPOs have become really popular too. Those are called preferred provider organizations. Those allow you to go outside the network if the doctor accepts it. Lots of times I would call a doctor and say, hey, I have a client who would like to use you. It was determined that he needs to see a specialist, orthopedic, and he would like to see you. And they can say yes or no. We'll accept them at just a little bit higher cost. Otherwise, you can pay and get reimbursed too. So PPOs will allow you to go outside the network. HMOs, you got to stay in network. And there's what they call low-income subsidy. They're called special needs plans. So lots of times I go into housing, low-income housing facilities, and a lot of individuals there make low income. So they qualify for these plans, which give them all kinds of benefits with zero copay. So again, those are really great plans for individuals who have low income. And then they're not in this state. I'm licensed in a couple states, but there's chronic condition SNPs too, where if you have a chronic condition, you might have COPD or some kind of heart condition where you can get into a chronic special needs plans also. Go ahead, Matt. Okay, so what to consider in choosing a Medicare Advantage plans. In this area alone, we have 46 different plans we can choose from. So the first thing we always look at is our prescriptions and pharmacies. We want to try to get the lowest prescription costs for you, and we let you know what the preferred pharmacy is. The second thing is, after we do that, we'll look to see if all your doctors are in network, because we want to make sure, I know doctors are important to you. We want to make sure the doctors are in network. So that's the second thing we look at. And then the third thing we look at is how important are the extras, the dental, the vision, the hearing, they all come with some kind of gym membership, right? How important are those features also? So what you look at an Advantage plan, there's parts to it where they're either low or no premium at all, which is a lot of individuals really enjoy that. Some have a deductible. Lots of them have no deductible. They all have max out of pocket. How much is my max out of pocket per year? So they cap me. So I know that if I hit a certain number, then I'm not going to pay any medical cost after that. What's my copays if I go to the hospital? What's my copay for MRI? And so on and so forth, right? So it's important to look at all those factors when considering if I'm going to go into a Medicare Advantage plan or am I going to go into a Medicare supplement plan, okay? Next, please. Okay, I always like this chart because I always look at Medicare supplement. It has a premium, lower out of pocket, right? It's really comprehensive, nationwide coverage, just as long as they accept Medicare, and I pick up a separate prescription drug plan. I always said this is my fixed cost because I know what my costs are. I'm paying a premium each month, and I know what my costs are, regardless of what happens to my health, right? The Medicare Advantage plan is like low to no premium at all, but I don't know. It all depends on what kind of health year I have. If I have a bad health year, I could pay a higher out-of-pocket cost than I could with the Medicare supplement. So I always tell individuals, someone who says, "Oh, I'm super healthy, I want to go into the Advantage plan." You know what? I'm not gonna pay any premium, and I get some dental, some vision, some hearing, and the prescriptions are included, and it's awesome. And I'm like, okay, that's cool. That decision is based on your health, right? It's based on what you want, and it's always based on what's important to you. That's who determines which plan you go into. You determine that. I just give you the options. I give you the plan, what's in the plans, and then you decide which plan works best for you. That's more my variable because we never know. I mean, I have individuals who might be super healthy, and then something happens to them in the mid-year, and they hit their max out of pocket for the year. So again, just a little comparison to see what a supplement is versus a Medicare Advantage plan. Go ahead, Matt. Okay, what to consider in plans. Again, what's covered, what's not covered. Doctors and hospitals. Is your provider a network? Are you willing to go to any hospital? Do you need a referral to see a specialist? Typically, HMOs, we need referrals, right? What's my premium? What's my co-insurance? What's my co-payments? What's my deductible? What's my max out of pocket? All very important things. I always give, we do summary of benefits for everyone to say, okay, if you go in an Advantage plan, these are summary benefits. This is what your copays are going to look like. So we have a full array of different plans to look at. And again, the decision is based on what's important to you. Go ahead, Matt. Other things to consider: prescription drugs. What will your drugs cost under the formulary? Check if changes to drug formularies and tiers. Is your pharmacy a preferred pharmacy? I mean, I have individuals who like to use a local pharmacy versus like a CVS, and sometimes they pay a higher price, but they like that their pharmacist. So it's up to them. Travel. Are you traveling outside the state part of the year? Some plans have better coverage. Are you traveling outside the U.S.? All the plans have coverage outside the U.S. Some have more than others. So is that an important feature for you too? So we always look at that. Star ratings determined by member surveys, plans, providers to give overall performance. 5 is the highest, right? So what we look at, it helps us compare plans because each October they have a updated star rating. And if you look at a plan that has a 4-star rating and you can see some of the reviews, right? It's nice to have a higher star rating. If you have a 1, typically they take those off the market. They don't stay if for like 2 years. I think it's 2 years in a row. But typically it's all based on our input, because every time you call the plan, they ask you, well, would you take a survey? And depending on your answers, are you happy with the plan? Are you able to see providers when you need to see them? Did when you called up customer service, were they able to answer your questions in a timely manner? So it's really important. We do those surveys and we have those star ratings. Go ahead, Matt. Okay. Right now, we're in annual enrollment period. It's October 15th, December 7th. Can we change our plans? Yes. This is the time of year we change our plans. You could change your Advantage plan to another Advantage plan. You can change your Advantage plan to a supplement. You could change your prescription drug plan to another prescription drug plan. You could change from a supplement into an Advantage plan. You can make any change you want this time of year. Millions of people are changing their plans this year, especially in light of the fact that some insurance companies discontinued their plans for 2026. So a lot of changes going on this time of year. So any kind of change you want to make every year, October 15th to December 7th, you can make changes. Okay. Now, open enrollment period happens in January. That's a second opportunity. We can make one more change, just one change. In the annual enrollment period, you can change as many times as you want. In an open enrollment period, you can make one change. So I can change from an Advantage plan to another Advantage plan, or I can take my Advantage plan and go back to original Medicare, pick up a Medicare supplement with a prescription drug plan. What I'm not able to do if I'm in a supplement, I'm not able to go into an Advantage plan. I have to do that in annual enrollment period. I can't do that in open enrollment period. Okay. And if you move outside the service area, they give you 60 days to make a change too. So I have people that are in Connecticut, and they move to Florida or Carolina, and we're able to make a change for them. I'm licensed in those states, so I'm able to do that for them. And there's what they call a 5-star rating, where you can enroll in a 5-star plan anytime during the year. One time option is available to you. So a lot going on in this annual enrollment period versus some of the other ones. A lot more people changing plans this time of year. But next one, Matt, please. So just wanted to give you some really good resources. So Medicare, 800-633-4227. They're excellent. I mean, you can call them up and ask them any question. They're 24/7. You can call them at 10 o'clock, 11 o'clock at night. They answer the phone. Or you can go on www.medicare.gov. Really great website. I encourage you to visit it and just to, kind of like look at it a little bit. And, great information on it. Social Security, you can call your Social Security office, but Medicare is the website that you really want to go to. And I'm available 24/7. I mean, I have clients call me all the time on Sunday morning. I'm always available to answer questions. I encourage my clients to call me when they have a question. Sometimes I'll third party them in, and we'll call the plan up if there's something that I can't answer that the plan has to help us with, like a claim that didn't get paid, for example. But I'm always available. So I have an email and a cell phone that I answer all the time. So I'm available also. So that being said, I love to answer any questions that anyone has at this time too.
And thanks again, Tom, for all the great information there. And if you have a question, you can actually, I believe, raise your hand in the functions tab, and we will unmute you. You can certainly ask a question. If you don't feel comfortable asking a question in this setting, I'd encourage you, to reach out to Tom or myself. If you would like, we can help connect you on that as well. And again, part of while we're waiting to see if anything queues up here, just a couple of additional comments. So, hopefully you saw Tom has a really great wealth of knowledge, and when it comes to all the different options and what goes into choosing those options to try and help you make an informed decision. Here at our firm, Thimble Island Private Wealth, that's really what we're trying to do with helping you prepare for this next stage in your life in terms of retirement. And a lot of things with retirement comes to, okay, how do we help you forecast and budget and plan for those different needs in life? One of the biggest things that we always include in plans is, okay, what are we factoring in when it comes to Medicare? We try and help you as best as we can, budget for those premiums, deductibles, co-pays, the co-insurance, like Tom was saying. And those costs can add up quickly, like he was mentioning. So, again, it's really important to kind of have that built into a plan when you're going into retirement. And again, a lot of folks where I'm sure folks have joined us today are probably saying, well, I'm not sure, really what those costs will look like or what my anticipation is. And that's where, again, we thought it's really beneficial to bring an expert like Tom in to introduce you to him, to, again, help guide you to identify, what does that mean? What does that number look like for me? And then how can I help, stay to that budget if we have a number in mind? And then secondarily, as Tom mentioned, there's some subsidies that are available depending on income levels. And then also, if you are sort of in that higher income earning bracket, some of that additional cost that might be there for Part B, there's different ways that we can also help manage and help you through cash flow and retirement from different sources if we want to stay within certain thresholds and parameters to qualify for certain special programs. So those are all things that we really try and bring together as a holistic planning firm to basically say, okay, let's put the sum of all the parts together, identify where and when we need that cash, and then the best sources to be able to help you accomplish those goals, all the while trying to help you plan and make sure that that portfolio is allocated accordingly to help you meet the long-term goals that you have in addition to healthcare and retirement, but some of those fun things in life there. So, with that, I Bryant, I'm not sure if there's any questions. I'm not sure if I'm supposed to be able to see that anywhere here on the screen. Oh, we looks like we've got a question from Dennis Riley.
Can you hear me?
Yep. Hey, Dennis, how are you?
Hi, good. How are you?
Good.
I had one question regarding the Medicare open enrollment period, January to March, maybe a
Yep.
two-part question. How does that work if you just recently signed up for Medicare within, let's say, the last couple of months, and you
Yep.
don't have you didn't do a supplement yet or an Advantage plan, which I saw those dates were December 7th. Is there,
Yeah, but you're aging into Medicare. Are you just turning 65?
I'm asking for somebody else, but say yes.
Okay, if you're aging into Medicare, so you have that 7 month window. So you have 3 months before the month of your birthday, the month of your birthday, and 3 months after. So that's what you would use to do the enrollment. It's called initial enrollment period. That's the enrollment you would use. So when is he's turning, or the person turning 65?
What if you've already signed up for, what if you're already in Medicare?
You're in A and B right now?
Yes.
Okay. And so when did you pick up A and B? How recent?
Mm,
Last month?
um, like October or November.
Okay. So you're in the initial enrollment period. You can enroll right now into, you don't even, this annual enrollment period doesn't affect you at all. You can enroll into a plan right now. It's called the initial enrollment period. That's what you would put on it. Are you working with a broker, or are you working with the company, like one of the insurance carriers directly?
Just a general question. Not working with anybody yet. Maybe
Okay.
you.
Okay.
But
Okay.
so
So we can use the initial enrollment period in order to enroll right now. So it's the annual enrollment period is used for people already on Medicare, right, or changing plans. So when you're either leaving the workforce, that's called a special enrollment period, right, because you pass 65, or when you're aging into Medicare, which you're turning 65, you have 7 month window. That's the initial enrollment period. You have 7 months to not only pick up your Medicare, but to enroll on a plan also. So you can enroll on a plan any day, next month, anytime you want. Yeah, you have time.
if you
If
wait, if there's 7 months, then it's not retroactive, is it?
so, your Part A and Part B is going to be is already in place for November 1st. So if your birthday was November 1st, that's when A and B became effective. Okay, so that's already in place. So now when we put a plan in, plans are always effective the first day of the month. So if you called me today and said, Tom, I want to get into a plan January 1st, we can do that. So I would make it effective January 1st. You can't go back. A and B is already in place. That's
Okay.
not going to change. Okay, but the effective date for the secondary plan is always the first day of the month. So if I'm in December, it would be January 1st. If I was in January, it would be February 1st.
Okay. Thanks.
Okay.
Terrific. It looks like the next question is Steve Chauncey.
Hi, hi Matt. Thank you for doing this, and hi.
Absolutely.
Um, I'm turning 65 middle of April,
Okay.
and so I guess how would it be best to handle this? And I was wondering what the range.
So do you want to go on Medicare A and B now, or you're ready to go on Medicare, or are you still working?
No, I stopped working at 60, so I've been
Okay.
on the state plan. My
Okay.
wife is 2 years younger than me, so she'll have to stay on that.
Okay. So
Mhm.
in January, it's 3 months before the month of your birthday, you were able to go on SSA.gov and apply for Medicare Part A and Part B.
All right,
It's going to be effective the first day of the month, right? So April 1st, when you get your card, probably in the end of February, you're going to get a card from Social Security. It's going to say, has your name. It's going to have the digits and numbers put on there. And it's going to say effective date April 1st for Part A, April 1st for Part B.
right,
You'll get that. And then again, you want to plan in place, secondary plan in place by April 1st too. So you're fully covered.
right. Okay.
Okay.
What's the range? What can I expect for costs?
For a Advantage plan or a supplement?
Well, I guess I would ask for both just
Okay.
to
So
see what
most of
you.
the Advantage plans don't have a premium. They just have copays attached to them.
Yep.
And the supplements range, the G plan is around 300 and N plan is about $60, $70 less. Um, like 250 maybe, or 225, or somewhere in that facility, that vicinity. I mean, for an end plan. So again, depending on how many doctors you see during the year, lots of times the end plans, they have a $20 copay when you see a provider. But if you're only seeing a couple doctors a year, it's the way to go.
It's the way to go. Okay.
Yeah. Okay.
No, sounds good. Thank you very much.
Okay. No, thank you. Appreciate
Thanks
it.
for joining
It
us.
was a lot easier working.
Yeah, honestly, I have a lot of people on big health insurance plans, Yale University, and I have other individuals who have small group health insurance. And the funny thing is, when they get into Medicare is so affordable. Some of the
Right.
plans are so much less expensive than the employer plans are today. So I do a lot of comparisons. Somebody who's still working say, well, should I go into Medicare or should I stay on my employer plan? Well, get me the summary benefits. Let's look at what you're paying. Let's compare and see what makes more sense for you.
Would it make sense to work with you compared to someone in Massachusetts? It's all the same, right?
Well, I'm based in Connecticut, so I'm licensed and appointed with all the insurance companies. I'm licensed in a couple other states too. So I think there's an advantage of working with someone in the state, because and not all brokers, but I make sure that I'm licensed with all the companies. So my alliance is to you. So if there's a plan that makes the most sense for you, there's some brokers out there that pick up 3 companies, for example, and they're
Right.
they're trying to put a square peg in a round hole, right? I'm not doing that. I want to make sure that I'm licensed with all the companies so I can give you the best option based on what's important to you. So,
Right.
Being in Connecticut, I have that advantage.
Okay. Thank you very much, Tom.
Thank you.
Thanks, Steve. And the last question looks like we have Melissa Lowry. Can you hear us, Melissa? Oh, are you on mute there on your end? I don't know if we've got her there, so
Okay.
give it one more second there. Melissa, can you hear us? And I can certainly circle back with her and make sure if there's a specific question that we get you guys connected on that too there. So with that, again, we really certainly appreciate everyone's time here today. I'm just going to flip back here just to have Tom's contact information there for anybody else that wants to jot that down. But again, our hope here today and with these sort of series of programs that we have going forward on a Friday is to get you together, hopefully 45 minutes or less, and give you a little bit of an update in terms of some things that are important to you, as well as some things that are important to consider when you're walking down the retirement path. So be on the lookout. We're going to have a new slate of programs after the first of the year here. Tom, thank you again for the time and imparting some of your wisdom on us here today. And I know I jotted a few notes down and learned some new additional stuff too. So again, with that, we really do thank everybody for the time here today. And certainly if there's additional questions, feel free to reach out. And I hope you all have a great holiday season and a happy new year. And we'll hopefully talk to you here in the new year.
And Matt, thank you for inviting me. I appreciate it. And again, I love helping seniors with their healthcare. So if anyone has any questions, you can email me or call me, and I love to be a resource. Thank you.
Excellent. Thank you. Have a great day.